So this is my video presentation for the thorax and then lung examination. So this will be my patient today, and then she's consenting to have this videotape.
Yes.
Hello Suzanne, my name is Regan May. I'll be your nurse practitioner student that will do your lung examination and then lung and thorax examination. Of course, you already washed your hands and then you already checked for patient's identifier. In this examination, you'll be using your stethoscope, you do your inspection and palpation percussion. So in the inspection, you assess for the patient's chest wall deformity. Face this one. Face this one. So you assess the chest wall and then you take notes for your anterior posterior ratio while the patient is seated. So when you inspect, you check for the breathing pattern. If there's any use of accessory muscles during breathing, you also need to take note of that. So to check for the AP ratio, you check the back, make sure that the posterior side of the back is half the size of your lateral side. And inspect for the nail for clubbing. Make sure that the capillary fills are less than 3 seconds. And then you check also on this side. So for the palpation, you check for the respiratory excursion. And then you do your top diaphragms. So you check and then you ask the patient to say 99.
99.
Okay, and then you will do the same for the posterior side of your lungs.
99. 99.
And respiratory exertion is when you put your arm here and then you ask your patient to inhale and exhale. So the expansion should be symmetrical in both of your hands. So the percussion is you check from left side and right side and then you compare it. So percussion technique is you use your non-dominant hand and then you tap it and then you can hear the resonant sound. So you start from the top, avoiding the bony prominences. And then you do a ladder sequence. You compare from both sides and then the other side. For patients who have a bigger breast tissue and then who has more adipose tissues, you ask them to move their breast up while you do your technique. And also you palpate percuss from the back of your chest. And the next part for your procedure is you auscultate, and then you have to do your diaphragmatic excursion and your percussion. So to do this, you need to make sure that the sound of your resonant and then the sound of the dial would be, you mark it when the patient inhales and the patient exhales. So you ask the patient to inhale and then hold the breath. You start it at the 10th rib. Inhale and hold your breath. This is where exhale, thank you, and we may resume your breathing. So from where the sound changed, that's where you will mark it, and then you will ask again to ask the patient breathe normally, and then during exhalation, you will ask her to hold her breath, okay? Inhale, and then when you exhale, hold your breath. From the 10th rib, you check as well. If there's a change, this is where the change, so that is, you might breathe normally. So that part where the change of your voice, the change of the tone is where your diaphragm expansion is during normal breathing. So normally it's around 3 to 6 centimeters, but some swimmers and athletes who can expand their diaphragm bigger. And on auscultation, you listen from the posterior side, the superior part of your lungs, and then you do the test from the anterior part of your lungs. As I put the stethoscope, you may inhale and exhale. Recording and progress. Thank you. Okay. So you check also the same sequence at the posterior part of your lungs. Inhale, exhale. And you avoid the scapula. Okay. Oops, no. That ends my thorax and lung examination. Baby.